Okay. Hello, everybody. Everybody ready? Okay. I want to thank you all for coming here. I appreciate the public tuning in for our update. We normally do a 12 o'clock Facebook Live during the week and then a 3 p.m. press briefing as the information is evolving and there's more and more coming out. Certainly, it's a Saturday. I want to thank all of our county team that have been working 24/7 for well over 3 weeks now. The work is tremendous. And to put everything in perspective, we've been seeing a lot of each other over the last week. Let's talk about where we started a week ago and where we are today. We shut down schools. We opened the Emergency Operations Center. We started a testing triage site before we had a confirmed case. We built in continuity of food operations for children, serving over 10,000 meals. We built in a continuity of food operation for our seniors. We created the senior nutrition line for new independent seniors that are now at home that need help. In addition to that, we expanded that line to include hospital workers who need help due to their work schedules getting meals and groceries. We shut down malls. We built a daycare infrastructure to meet the needs of our healthcare and emergency management workers and also essential businesses. We've implemented well over 75% social distancing as a community. The Syracuse Economic Development Corporation and Mayor Walsh came out with loans related to small businesses in the city of Syracuse. The SBA came out with a loan program that everybody can take advantage of. The Onondaga County has created bridge loans in partnership with that. And the COVID-19 Foundation Fund was created for people to be able to donate philanthropic funds to help our nonprofits who are on the grounds fighting this. We've had a busy week, and it's just going to get busier. President Trump declared New York a disaster area. According to FEMA guidelines, that's an important part of this process. That opens up new pots of money from the federal government to flow through states, then through local governments. I want to specifically thank Senator Schumer for his advocacy for this, and in addition, his advocacy for counties. And I want to specifically thank Congressman Katko for his advocacy for counties and for this declaration. Related to the numbers, we have an update for you. Remember, when we started this triage testing site, our goal was to get every person in this community who has symptoms of COVID-19 tested. That's how we get ahead of this curve. That's where we are right now. The numbers have increased. We knew they would. We've had essentially 700 tests come back. 34 of those tests are now positive. We are undergoing investigations into the new 21 positive cases at this point to look at any of those that may have been individuals in quarantine or any of those related to each other. That information and those investigations are ongoing at this time. I'll give you a breakout of the ages. First, there are 19 females who've tested positive and 15 males. There are 13 individuals under the age of 40. Let's keep that in mind throughout this briefing. Ages 40 to 69, ages over 69. At this time, our information shows that we have 2 individuals who are in the hospitals. Part of our data that we will be talking about in this moving forward is not just how many positive cases we have and how many cases we've had negative or who's in the hospital, but we're going to start to talk about recoveries at some point in this too, because that's part of the process for the community to understand. Most people recover from this. And so certainly these are our neighbors. These are individuals who are our friends. We know them. They did nothing wrong. They got sick. That's all. Looking at that, what do we see by this? We knew these numbers would go up. They're going to continue to go up as we get more and more results back. We are very, very happy with our ability to have testing done every day in this community and done in a robust way. We've secured enough supplies for more testing throughout the weekend. And certainly we're on pace to secure more supplies to make sure that we're testing into next week as well. As we get more information in related to the negative tests don't just come in a clearinghouse. Our health department gets the positive tests, and they're the ones who have to make the contacts. The negative tests we're getting in from all the different areas who are doing testing, your primary care providers, the triage site, Upstate, Crouse, St. Joe's. But we anticipate hundreds of more tests to come back in today and tomorrow and Monday. Okay? One of the interesting things, the data that we're seeing now, which we think is promising, but we'll see if this data point holds up over the next few days. But our Upstate triage hotline, the call volumes have been robust, answering questions. The call volumes are starting to go down a little bit. The referrals to the Syracuse Community Health Center triage testing site from these calls are starting to decrease a little bit. We had 174 test kits that were performed yesterday at the triage site, which was down from 227 from the day before. And right now at 2 o'clock, we had 60 referrals today. So we believe at this point that this means that folks who are sick and have symptoms of the flu are getting the tests, and that we are testing and we're getting to these people. These people are coming in. We're staying ahead of this curve, which is very, very important. I certainly want to highlight one of our partnerships that the city and the county and the Syracuse University created earlier this year with Microsoft. We created a digital alliance with Microsoft. This digital alliance at this point is being utilized by Upstate, and Microsoft has created an algorithm and a tool where people can go on and do an assessment tool, and they can then look at that algorithm, and it will give people an indication of maybe they should talk to their doctor based off of symptoms. This is a great way that we're utilizing technology all together. We want to thank Upstate, certainly want to thank our partner Microsoft, who is all in this with us to help starve this virus. Certainly, let's talk a little bit and remind people about a quarantine. Right now, our numbers are fluid with the investigation, but we have 80 people in a mandatory quarantine right now from these cases. For the public, as we continue to test some of these quarantine residents, the health department will deem necessary to get tested. Certainly, we do anticipate some of these 80 people will test positive at some point. And as the investigations happen, you work through the data, we'll be able to talk about how many people are related to quarantine that are positive, et cetera, et cetera. But you're in a mandatory quarantine for a reason. Either you're sick and you got tested, which means there's enough evidence that we had to rule out COVID-19. Remind everybody, there's an executive order that you need to stay home. You don't get tested and then stop at the grocery store to get some groceries real quick. We have a hotline where we can help you do that. You go home, okay? And then if you need any supplies or materials, you can call our senior nutrition line, which is right here, 315-218-1987. We need you to stay home. In addition to that, reducing the stigma of the positive test, we now have 34 people in our community. They've done nothing wrong. At some point, you're going to hear about this, or the rumor mill is going to be flying about this. It's already going on. They're our neighbors. We need to pray for them. We need to help them get through this. This number is going to increase. You're going to know people who are in a quarantine now. They did nothing wrong. The only thing that they did was get sick with a virus that we don't yet have a vaccine for. Okay? Social distancing in young people. We're going to talk about this today. Certainly, I was born in a year where I was not quite a millennial. I think I was Gen X maybe. I'm not going to go into much more of that. But certainly some of these younger generations to date on spring break have disappointed their parents and with some of their behavior, and have disappointed the public at large with some of these videos that we're seeing from these beaches. You still have a time and a chance to redeem yourself now. For our college students that are coming back from spring break, we really need our colleges to watch these off-campus living. For these college students, I would recommend you go into a self-quarantine when you come back from spring break. Let's see how you're doing, see how you're feeling. Don't be irresponsible. You are already irresponsible. Now don't double down on that. Okay? This is what we're doing. This is how our plan is right now to starve the virus. We started out by trying to identify anyone who's sick and anyone who needs to be quarantined. That's an ongoing process, but we're ahead of the curve here. What we've seen is many cases are coming in from outside of the area. We are very much connected to New York City. We've seen travel be part of that. That has helped create to the ability where the virus can just spread through the community spread. So now where we have people coming back into our community who've been socializing with people from throughout the country, a self-quarantine is the responsible thing for our young spring breakers who are coming home now. Report on the non-medical task force. Certainly our social and emotional health task force is up and running. This is critical now. We're being put in situations we're uncomfortable with. And certainly being at home and needing maybe an escape from that, we encourage people to remember to call 211 with any concerns that you have. Talk to people. Your mental health is important. Certainly we've had weather where we can get out and walk. I took a nice walk with my family this morning. I talked to the mayor. He was taking a walk with his family. Chris Baker, I encourage you to utilize your front yard, please, to take a nice walk when you get home. But let's take a nice walk, get to our park system, utilize that. Mental health is important with this. I also want to thank all the parents who are at home and who are helping talk to their children about what's going on, and I know it's a lot on you right now. So I want to thank you. You are on the front lines of this with us because we need everybody's social distancing. It starts with you, so thank you. Again, our senior and first responder nutrition line is here. This is a line, since we've opened it up, we've had 400 requests from the public. That's what it's there for. If you are a senior, you're at home, you can't get groceries, you need a meal, please call this line. We've partnered with all of our food infrastructure that we work with on a daily basis, but in addition to that, we've built restaurants into this. And so we have the ability to help you. We want to help you. We want you to stay home so we can keep you safe. Daycare. We now have an abundance of daycare slots available. Daycare for our healthcare workers or our essential businesses. If you run into emergency situations, we have well over 1,900 slots available now. So this is something that if you need help, we have it. I want you to call 315-446-1220. This would be a service free of charge for that situation. We're working with our hospitals for potential solitude places for our healthcare workers as well. Right now they're under a lot of strain, so we're working with our hospitals and partnering with different hotels to have hotel stays available for some of our healthcare workers as well. Let's take care of our neighbors in this time right now. You know, over the last few days, not at this briefing, but at my noon, I've given some really positive feedback I've been receiving from some of our community residents. Cameron and Joe, they have moved from my inbox. I hear they're on Facebook now. Maybe a couple others are on Facebook that are leaving me some love letters. I'm going to find you, and we're going to talk about it. But I got an interesting one here, a little humor here. We can all learn from the Vulcan. Spock was a visionary. I agree. In 1966, he could see into the future, anticipate that we might need another way to greet each other. The handshake had been around for thousands of years. One popular theory is that was a gesture that began as a way of conveying peaceful intentions. By extending their empty right hands, strangers could show that they were not holding weapons and bore no ill will towards one another. But Spock envisioned that we needed a way to greet each other from 6 feet away. Spock was a visionary. We need to learn from the life of the Vulcan, live long and prosper. So that was a great email I got yesterday. I agree 100%. But right now, I think it's important that we put all this data into perspective. We look at where we were a week ago and how well prepared we are today. We look at that this is going to be challenging from our mental health and the fact that we're not going to be able to do things and it's going to be an inconvenience for us. But if we do everything well right now, the time period where we're inconvenienced is going to be less. And I just want to tell 2 stories real quick as I came to work today. I was driving down West Onondaga Street, and first thing I saw were children coming from one of our food sites with food, with bags of food. And I wanted to thank, again, Abundant Life for their $60,000 donation that they made to keep the meal plan going through. That meant a lot. And then as I drove through by the rescue mission, I saw two of our members of our community who live on the streets giving each other, walking by and giving each other an elbow bump, not a handshake or a fist pump. I thought it was pretty cool. So the community is responding very, very well right now. We're going to continue to be tested. We're going to continue to have more positive cases. But our goal was always to test everyone who had symptoms and that was sick. And if we did that and we accomplished that goal, we could get in front of this and we could really bend the curve very quickly. So saying that, I will take questions and Dr. Gupta will take questions.
Right. In Albany and some other counties, we're seeing tests be limited. They're sort of rationing tests to people who are high risk or medical professionals. Are you saying we're still testing anyone who is symptomatic here in Onondaga?
Yeah, we're testing anyone that a doctor believes meets the criteria, which they've been given criteria at different points of the process, Chris. I think sometimes that criteria was being liberally interpreted, sometimes it was more conservatively interpreted. But right now, we have the resources to keep the triage testing site running and running effectively.
What's our source? Where are we getting more kits from?
So we're working with the state on a daily basis on getting more kits in. We're working all of our procurement channels. We're spending a lot of money trying to get in front of this for emergency management supplies. So we've gotten lots of tips in from various people in the community. Some of these tips have led us into different stockpiles. And so we're trying to procure things ourselves, and we're working through the state each day. I think what's important, too, and I think we still have well, maybe we don't have it, the fact that we are, in Onondaga County, upstate New York and northern New York's front line for this virus. We have upstate. Upstate, there's two state maybe there's I don't know if they have West State. I don't think they do, but we have a downstate hospital and an upstate hospital. Upstate really has a charter for many, many counties. We're going to get our graph updated by counties that have come to our triage site. What we're seeing is a couple trends. One, as other parts of the state have not been able to do testing as frequently, all of a sudden those counties are popping up at our triage site. And secondly, that we continue to be the hub for all of central New York and northern New York. So my only plea to the governments that are larger than us is we have no problem being on the front lines for all of our neighboring communities. We just need to be treated like a community of over 1 million people, not a community of 500,000 people.
How are supplies, how are other supplies like masks and gowns? We know the governor is sending about 1 million downstate.
Yeah.
How are we doing in Central New York?
I'm glad it's loosening up for our friends downstate. Certainly we're going to ask the state if send some up this way. We found some other supply chains in other countries that we're going to be utilizing. I've been working with other medical professionals where elective surgeries have stopped, and hopefully get some of those the supply chain in. The supply chain today is better than it was yesterday. Now, this is all fluid. Our data for testing is starting to drop off in the community. My hope is that's because everybody who has symptoms and who a doctor believes needs to get tested is getting tested now, and we're getting our arms around this. We're really getting in front of this. But we could see a new spike at any time. So we're going to need to really continue to have the resources here to perform well, and we're going to continue to advocate. And we've been pit bulls, and we'll continue to be pit bulls.
What is the turnaround time for these tests, and do you plan to save the rest throughout the week?
Depends on who the provider is. Kraus has their own provider they're using. Upstate's using the Wadsworth lab. That tends to be, at least in our empirical data, the quickest turnaround time. The health center, our triage site's been using Quest. That's a 3 to 5 day turn time. And the primary care providers all using their own testing partner. So I think, if you average it out, I think it's safe to say we're going to get data 3 to 5 days.
It looks like we've got 21 new cases from yesterday to today. Can you say how many of those came from the triage center?
Tough to tell, but I believe we had at least. I don't know the estimate, Chris. I know some came from Kraus, and I know some came. At least 8 came from the triage site.
So that's it. I think yesterday there were none yet from the triage center.
Right.
Since the first cases coming out.
Correct.
The two people who are in the hospital, can you give us a condition on them?
You heard, Doctor?
Yes.
Come on.
One is in stable condition. The other one, the other one is actually in critical condition, and continue to be stabilized at this point.
Underlying health conditions in both of those hospitalized patients?
So underlying health condition, yes.
In both?
Yeah. Sorry, what was that?
One unstable, one in.
Oh, one is in stable and other one is in critical condition.
Ages for the people in the hospital?
What bracket are they
Right.
in? Over 60?
The one is over 60. The second one is over 50. So between 50 and 60.
Of the new cases, is there a pattern about how they're spread across Onondaga County? Are any connected, husband and wife, families?
The new ones have come in so fast that the health department's going with investigating right now, Andrew. We had, out of our 34, we don't even know the ages of 3 yet, right? So they're doing that. At the end of the day, our 20 investigators and all their support teams get together who are working on this, and they communicate, and they start to put the puzzle together. I'm sure there's probably a couple of these new cases that were related to the original 13. We don't have data on that. I think one of the things we're looking at now is we're looking at mapping out cases geographically and sharing that information as well. Other counties have started to do that. But certainly one of the data points that I would like to reiterate, 13 are under 40 of our spring breakers, and our young people are not immune to this. And so that's right now the leading demographic in our county is under 40. Now, so let's just think about that. Okay.
Can you be any more specific with those ages? I know in Portland County they had a small child who was diagnosed. I mean, under 40 is a pretty wide range. Only people in their 20s, 30s.
We don't have any information on children at this point.
Means there are none, or you just don't have that information?
We don't know who the other 3 out of the 34 are, but right now we don't have any information on children.
How is law enforcement planning to enforce this social distancing thing when spring breakers do come back?
Yeah, look at the community is not shy to email our office. When we get tips, we'll investigate those tips. We'll clarify for businesses with our law department what the law says, and then look to our private sector. Don't be that guy, okay? Don't be that guy that keeps their business open when you know you aren't supposed to, and we got to send a sheriff out there who's supposed to be doing something to protect the public health, and they got to go deal with some knucklehead, okay? That's our advice. Our patience will be very minimal for that person, that first person. You don't want to be that first person. If you're not essential, shut down.
You sent the sheriff to any businesses?
Not yet.
If you are essential, is there any guidance for practices as the business continues to operate? I was in a grocery store that will remain nameless today, and it seemed busy. I'm not sure it was below that 50% fire code standard, but it was busy, and it seemed like it was scary.
Yeah, I think some of the things, Andrew, are going to be really tough in real time to monitor, especially if you think about it. Our government is trying to implement these same policies just because it's smart to stop the spread, right? So, but certainly, if we believe that there is a business or a essential business that is practicing things that are harmful to public health, we will work with them to make sure they're implementing the right policies. Grocery stores are going to be difficult. It's going to be really hard. And I would just suggest people in lines, usually you've got a big grocery cart in between you anyways, you get about your 6 feet, but certainly let's be smart at the grocery store. Let's just calm down. The food supply chain is intact. It's getting better. We're seeing it better in the stores, on the shelves. And I have another call next week, but at the end of this week, there's no issue with the food supply chain. There's going to be plenty of food. And again, if people can't get to the grocery store or are scared because they drove by their favorite grocery store and parking lot's full, call our line, especially our seniors.
Is your office the best place for
that's been a clearinghouse right now. That's for sure. Most of our emails, we've turned Cameron sobered up, and now we got most of our emails are now constructive emails related to the community or real concerns in the community, clarifying a lot of questions last week on the governor's rules on essential, non-essential businesses, and our teams have done a fantastic job of getting information out to these businesses, and we're really proud of them. We're really proud of our health department. We're really proud of our emergency management department. All of our, my office, these people have been working for 20 straight days, and I know you guys have too. I think I've seen most of you every day, so.
I want to give people the right direction, though. If there are complaints because our newsroom is getting that a business is open that's non-essential, is it your office?
Yeah. Yeah, call my office. Yep, call my office, email me. That's, yep.
I know you said that investigation into these new cases is still ongoing, but if any of these people had a job where they were in close contact with the public, when should we expect to know more about it?
So how, and we just went through this with a couple cases, right? So our health department's going to do an investigation, and part of their investigation is looking at this individual's work history, talking to their supervisor, seeing who they may or may not have been in contact with, and then they go, that leads them to the next amount of people they need to talk to. So when there's gaps, or when a business is not cooperating with us, we then will go to the public and say, were you in this business during these period of times? If you were, please contact us. If you have any symptoms, please contact your primary care provider right away so we can give you advice on getting tested. So there's going to be times where this is going to be very fluid. There's going to be times where people will work in areas where they will have contact with the public. Certainly we know that it's been well reported about the one individual who worked at the airport, right? Airports aren't that busy these days, okay? So it was easier. We got lucky because of that. It was easier for our health department to do their investigation into figuring out who that person was in contact with and who they then needed to put under a quarantine.
Do we expect to see the malaria drug coming to Onondaga County at all?
I think each primary care provider in our hospitals will determine what the treatment would look like. Dr. Group, is there anything you want to touch on that?
So there has been a lot of discussion about different new modalities of treatment that has been discussed in our community as well as. At this point, does not seem like, unless there is evidence in the literature and there has been proof about that. So at this point, to my knowledge, it has not been instituted, but there are discussion about anti-malarial as well as Plaquenil, which is used in rheumatoid arthritis. There's another one, antiviral, which was used in some other diseases. So this is work in progress, and we should not implement anything in our community unless we have an evidence base. And we have a fantastic faculties here, infectious disease, in all three hospitals. They work together and look for the right information. Is that the right thing to do? So this is pretty much a continuous discussion at this point. So I think there's, at least to us, we have asked this question. Hospital keep track of all these things, and they have been in communication with us. I don't have any regular count, but certainly maybe.
Yeah. So as part of our planning efforts for surge sites, whether it's a surge site for triage for ICU beds, part of that is trying to identify ventilators and where we can get them. And so that's a work in progress. We talked to Upstate earlier today. Upstate has had a couple good days, and they got capacity. So they're kind of ready for what's going to come. So I heard in the governor's press conference he thinks he might have 6,000 of them that he can buy. Certainly, I think we merit some of those.
What do you expect is to come?
Look, I think we're going to get more and more results back. We're going to get more positives. That's important to us because we get to identify and then quarantine. We've done the necessary policies to social distance. If we think there's gaps, we'll react either at the local level or encourage, if we think it's a statewide policy that should be had. Yesterday, I put in an emergency order asking to end elective surgeries and it went to the state. They thought it was a good idea, and the governor announced it at his briefing. Perfect. So there's things that when we think there are gaps, we'll work at the local level for an order, or if we think it would make sense for the state to implement, we'll pass it on. If they think it's a good idea, they'll implement it.
What's your biggest concern right now?
Yeah, I think really right now I'm concerned about the community taking this seriously. I think we are. I think there's parts of the public overall, maybe not in our community, but we don't know that yet, that aren't taking this as seriously. And if they take this seriously, we've put ourselves in a position to have some success fighting this by testing as much as we have and getting the data as quickly as we're getting it. So you would hate that we see a downtick and we start to see our curve go like this, but then because a bunch of 24-year-olds come back from spring break and they don't take advice and we start to see an uptick again. So let's be smart. The social distancing is in place to starve the virus. We're trying to identify everybody who needs help, who's sick, and certainly then the quarantines happen, and we know some of those quarantines will become positive cases, but once they're quarantined, that really helps mitigate that. So I think overall this is good, and we were very busy last week. We were ahead of this. That's good, but we don't know what's going to come next, and what we've been doing is planning with resources. Certainly for the next 2-3 days, we think our resources are strong. We've identified some supply chains that are interesting, and I think they might pan out well for us. So Andrew, I'm just, I feel pretty good. I thought, you get 21 new cases. When you just hear that, if that's the only information you had, in my shoes, you probably wouldn't feel as good. But overall, when you look at everything, you look at the big picture, you look at the demand at our triage sites going down. Now that's 2 days, but we've been open for, 6? So that's 30%. We've had a decline 2 straight days. That's positive. We've seen the demand at Upstate's testing down a little bit. We've seen the demands at Crouse down a little bit. So maybe we're getting to everybody who's sick. Maybe we're not. Data will tell.
Did you just beat me to my question? What's the good news today?
That's good news. And I got to tell you, there's, I think the good news, I love how you love good news, Andrew. But overall, I think the community is responding very, very well. And you see all these great stories each day, and you see people responding, and we're getting inundated with emails, how can I help? We're getting inundated with volunteers. But right now, I think the percentages of positive to negative percentages are, they're a little bit below the average, a little bit above, depending on what comes in. So that there's nothing really that alarming with that we didn't see happening. And I think the good news for this community is that we have absolute professionals doing the work right now in our health department, in our emergency operations center, in our doctors, our primary care providers, our grocery store clerks, our daycare providers. They are absolute professionals, and they are handling this crisis with absolute professionalism.
The federal government's put aside some money for local and state governments. Is any of that money coming our way? Is it going to be used to hire more health investigators?
Right now, Chris, what we're doing is we are not spending money waiting for other money. We're just spending money based off of the need. Our hope is that we'll be reimbursed by FEMA, whether that's through the state or whatnot. But we think we found a supply chain for a lot of ND95 masks. We're ordering a lot of them, and it's going to cost a lot of money. And so we're not going to get behind in this process because of money. We think that we will get reimbursed via FEMA and whatnot. So if we have to go buy ventilators, we're going to go buy ventilators. If we have to go buy masks for all the hospitals and worry about how we get paid back if we do or don't, we're going to go do that, because our job is to make sure that we take care of our community's most vulnerable, our sick, our elderly, and our children. And it's, part of this process too in fighting this is worrying about the economics too, how we mitigate that. And I just look at it as it's our pie platform on steroids now. When we're talking about poverty, infrastructure, and economic development.
If I can just go
We have tests. We have tests. So right, I'm gonna, we're making assumptions at this point because it's too early, but what this data is starting to show is that there's less people that are calling in that are symptomatic and sick. And so the one assumption could be is we had a great week of testing, and now that's going to slow down, and maybe we'll get a batch and we'll be able to start to level off this curve a little bit. This data, I might be back at you on tomorrow or Monday and say we had a 2-word downward trend and now we got a 3-day upward trend. But right now we got a 2-word downward trend, and it's not because there's not tests at the site.
How long before we start retesting people who have tested positive?
Doctor, do you want to talk about that? When they're positive, when do you test them again?
So initially at this point, you're asking those people who were COVID test positive.
At some point, I assume we test them again.
Right. So at this point, the guidance is that we have to do 2 testing before they can be released, but that's subject to change at this point, because based on the clinical symptoms, how they are feeling, a lot of those things with our staff can continue to communicate with them. The guidance might change, and also depending on the availability of tests. So at this point, when those people started from day 1, when they were put in mandatory isolation, and depending on their symptoms, then we go and find out, then we'll have to do 2 or not. That's continue to look for new guidance from state.
Ryan, you mentioned spring breakers more than once.
Mm-hmm.
Are we actively aware of Central New York 20-somethings on break right now? Or are we just assuming based on the national stories that we might have some?
Look, at the national stories are just, I mean, I was 19, 20, and 21-year-old once too, and I thought I was bad, okay? But we do have a concern about some of these kids who are off campus coming back, and instead of going home, coming back to their off-campus houses. So if we don't have any empirical data to say this many people are doing that, we've heard concerns. We need our colleges to step up, and they are. And if they're listening to me, and I think I've said enough today to maybe get their attention, that just put yourself in a little self-quarantine, and get yourself healthy again. You went hard. Now let's get yourself healthy and see if you have any symptoms. And if you do, you got to call your doctor. And if you don't have your doctor, call our triage line. My hope is that we'll continue to see less need at the triage center getting tests, because the people who are sick, that influx of whether it was influenza or whether it was any other respiratory illness, that we got them tested. And now we know who's got COVID, and we know who needs to be quarantined, and now we can really start to get in front of this. Bad behavior with people coming from outside the community into the community, and then not doing the right things with social distancing could set us back a little bit. And the longer it sets us back on the health side, the longer it's going to set us back on our economic recovery.
Ryan, can you assure the public that you and your office will widely spread information as long as it doesn't violate HIPAA?
Yeah, I think, look at if we're talking twice a day about information, and we're giving you information. I could have told you we had 31 cases, but we have 34, and there's 3 that is brand new as we're walking over here, and I don't even have the information yet. So we're sharing information with you as we get it, essentially twice a day, and we'll continue to do that. And the only way we get in front of this is by sharing information, and so that the public behaves in a certain manner to help starve the virus. One more question.
As of now, is there any plans for schools to reopen again, or should they be planning to cancel in preference of vaccinations and stuff like that?
Yeah, I think it's a little too early for that. I think certainly colleges will do commencements. Colleges are in a better position for online learning right now than our high schools and some of our elementary and middle schools. Part of the process, when you reflect on the last week, there's a lot of anxiety just to shut it down. You can't just shut things down when you don't have continuity of learning, you don't have continuity of food, you don't have daycare. And so we took a balanced approach to that and let the data drive the process. So I think certainly there are inequities in districts right now as far as their continuity of learning goes right now. And some of those school districts, we're not going to highlight where we believe there's inequities, but it happens so fast that now they need to catch up and figure out how this is going to go. But certainly, I do believe schools will be shut down past April 1st. Our date was April 14th. The governor came in after us and said April 1st. He wants to see plans as far as learning continuity, daycare continuity. We took care of the daycare plans for all the school districts. We got that settled and handled. But the continuity plans for learning, I think certainly the districts need to work on. And I've seen some of the districts, Baldwinsville High School's, Baldwinsville District's done a great job. How do I know that? My wife's an educator there, so I get to see everything that's going on. But I think that's something that it's a new reality. I think these first few weeks everybody's taking it in, and then the reality is that these districts are going to have to get to work and keep their kids on par.
You brought up Star Trek. Do you prefer Captain Kirk or Captain Picard?
Look, Captain Kirk is fantastic, so I guess I'm going Kirk. Thanks, Chris. Good question. Anything else? Thank you. Yeah, in the back, Josh?
Yeah, Ryan, we touched on other jail as well. We touched on elderly or college kids. How should parents be addressing coronavirus with kids 18 and under? Just because birthday parties canceled, kids
Yeah.
sit at home, you can only play so much PlayStation. They want to go outside. How should parents be addressing this with kids 18 and under?
Yeah, so I live in a neighborhood, there's a lot of kids. So I know most of them. So if I see like 8 or 10 of them playing, I'll stop and yell at them and tease them a little bit. I've coached a lot of those kids, but it's tough. Right? I have 3 kids. They're already stressed. For them, they see their dad. He's not around a lot right now, and my wife's really stepping up. But overall, I think we got to talk to our kids and let them know this isn't a situation where somebody gets sick, they're not going to get better. Most people get better. And these kids are worried about their grandmas and their grandpas. But I think we got to talk to them. And then, let's get creative. I think one of the opportunities with this, and I was talking about this earlier, is that we get to slow down and we get to really take into account what matters in life. There's a lot of regrets when someone passes away and you didn't get to have that conversation with them, and you miss all their imperfections. Now's a time where families can get back together and appreciate each other's imperfections and really slow down and get acquainted again. And technology, I think, is most of the time people want their kids off technology. Now it's a great tool for parents to stay sane when they need a little break. But I would really, we're being forced to slow down as a society and as a community right now, and that might be a good thing. Okay? Thanks.